Hi, everybody. My name's Leslie. I'm a case manager. A couple of things. The sheet that's going around, we're a co-ed facility. It's showing it's female only. That's not correct. We're a co-ed facility. And so I'm going to talk about three of our programs. The first one is our pain management track program, It's run by Dr. Peter Preskoff. He comes to us from Loma Linda, and the program's been in operation for several years. The program, you need a primary diagnosis of chemical dependency, and it treats various types of chronic pain, arthritis, chronic fatigue, chronic tension type headaches, fibromyalgia, neuropathies, post-lumpectomy syndrome. I'm a little nervous. It's a holistic approach. He's doing mindfulness, meditation, Tai Chi, Qigong. He also meets with them one-on-one with a female present. It's a 45-day program, and the first 30 days are inpatient. They do their treatment during the day with the rest of the patients, and the afternoon is spent with Dr. Peter and the rest of the pain management track patients. They are working on trauma issues. They are working with Dr. Peter. They're doing CBT. They're doing a lot of different things. It's working from an Eastern philosophy. We have a lot of patients coming to us from workers' comp that workers' comp companies are paying 100% of that program, that have had surgeries, that have had a lot of stuff done with them through workers' comp, that have not gotten any relief from their pain, and they're coming into us. Prior to having this program, I've been with Betty Ford Center for 12 years, in case management for 7. And before we had this program, we would get chronic pain patients that would basically come in, participate in the morning, and then do nothing for the rest of the day. They'd go into their rooms, they wouldn't come out. Since Dr. Peter came to us, they have started participating and reporting pain-free living. And it's amazing. It's a wonderful program. The second program I want to talk about is our Licensed Professionals program, which is led by Dr. Harry Hartunian, who recently had a book released, Being Sober, a step-by-step guide to getting through and living in recovery, and John Pestaver, who is the director of the Clinical Diagnostic and Professionals program. This program is for licensed professionals and executives who may have specific requirements to consider when seeking treatment. We are working with their monitoring agencies, their monitoring agencies, and working in close collaborative with their referents. Anybody that's involved with them that needs continuous updates on how they're doing, if they have reporting that needs to go back to them, return to work, documentation, and advocacy. There are case managers that work with them that are involved all the way through their process. They are also, they have specialty groups that they attend. The professionals group, the Caduceus, Birds of a Feather, the Other Bar, they're all involved in those specialty groups as well. They also are attending the relapse workshops, the codependency and trauma workshops as well. And then finally, as all of you know, is our children's program. And we have 3 locations for our children's program, which is the Rancho Mirage location, the Aurora, Colorado location, and Irving, Texas location. That program is open to children 7 through 12. And on occasion, if there's a 13-year-old that's very immature that wouldn't fit for our family program, they'll bring them into the children's program. There is no child is turned away due to lack of funds. The parent does not have to be a patient in the Betty Ford Center program. They can come from anywhere to participate in that children's program. They learn about addiction, alcoholism through age-appropriate exercises. They learn that the disease is not their fault. They didn't cause it. They can't cure it. And it wasn't their fault. And as all of you know, we're very fortunate to have Jerry Moe and a tremendous team of professionals working in that program. I think that's it. I'm really nervous. We have a lot. Oh, go ahead.
Well, just how long do the children come for? How long are the children there?
They're there Wednesday through Sunday. The parents come in the very beginning for a very short period of time to help the children kind of get acclimated, and then they participate with the kids at the very end.
Other questions? The evaluations you do.
The clinical diagnostic evaluation.
You know, Garrett kind of helped that get started.
Right.
That's what Jerry Moe, I mean, they're expanding that. It's just on and on and on and on. So, and I've been doing business with about 1982, and I went to one of Betty's first Key played golf with President Ford. I carried his bag. So they've been a good friend of ours for a long time, and the industry. For Betty, myself, I'll start crying, but what Betty did for our industry, just with her name and her bravery, nobody could have done that on television or anything else as far as what she did. And then to come out and talk about her breast cancer because she didn't want us thinking that she'd had a relapse. That's pretty brave. They've done a great job. Any questions? They've been around long. Yes.
Linda, I'd like to give a shout out for Betty Ford. I had several of your clients just at house recovery and really, really well. I mean, they were well residents and you guys done sort of that.
It's I mean, I gotta say, I've been there for 12 years, and it's an amazing place. And one of the, like, in the time that I've been here, I've had a couple of women, I work on a women's hall, and I've had one woman text me and say she's taking a one-year cake. She wants me to be there on Friday at the alumni meeting to see her take a cake. I have another woman that goes to my women's group that spoke, took a one-year cake. I mean, a lot of the people that have gone through my hall that I know have become members of the community. There's a little girl that went through our young adults program, is now working at the Starbucks I go to. She was very proud to show me that she called me on her one-year birthday. She's working at Starbucks. She shows me her little bike. She's totally excited. She told me about her first date that she went on. I mean, it's an amazing community. I've known John and I've known Keith since I basically started working there. I've kind of grown up there myself. You know, it's, I never thought I'd get to work there. I went to a treatment center in Desert Hot Springs, which is like the ghetto of the desert, and I used to joke about, one day I'm going to be at the Betty Ford Center, and, you know, I got to do that, so.
Yes.
Any thoughts on the merger between Hazelden and Betty Ford?
You know what? We are the Betty Ford Center.
Yeah.
The merger is a marriage. We will remain the Betty Ford Center. The byline under the sign will be the Hazelden Foundation at Betty Ford Center. That's what I know. Mark Mishak from Hazelden is going to be moving out to the desert for 6 months. He's looking for a place to live. And he will be finding a new CEO for the Betty Ford Center. And as far as I know, that's what's happening. It's, you know, as John said, when Mrs. Ford passed away, the book of Betty Ford Center was starting to close. There's a new book being written, and it's going to be exciting to see what that book is going to be about. It will continue to be about treating patients. Our census is up. We're continuing to treat patients. Our mission is very similar to Hazelden's. So we'll see what happens. I'm excited to continue working there and to continue to do what we do. We treat chemical dependency, and I hear a lot about what you're doing, and some of the things you do, we don't do. So we'll continue to pass on what we don't do to benefit what you guys do, and we'll share. Because like John said, it's a huge sandbox, and we all benefit each other. So.
And yes.
I just wanted to say something and then a question too. I had a lot of experience with the family program, and one of the things I've always respected about Betty Ford and it helped my clients back when I worked in treatment was just that you guys would take family members from anywhere for the family program. And when it comes to the Al-Anon case and the really I wanted to make sure that you guys still offer that. Was my question.
Yeah.
My question.
Absolutely.
I think Susan, the rumors that are going around, Susan's going back on the board too. She left for a while. I think she's coming back on the board, which I think is a big impact on Betty Ford. Any other questions? And also, as far as Leslie, I worked in a lot of the phone centers, keep an eye on training and everything. There's never been anybody, she's not there anymore as far as the admission, but she was one of the best I've ever seen. The way she worked with those families and how she believed in getting that interventions involved and the escorts and everything else. She knows the disease so well, and she knows that seamless continued care. And we really missed her. How long have you been out of there?
I've been in case management 7 years now.
Yeah, but it was difficult to lose her because both T and I relied on her. But I just want to thank you from the bottom of my heart what you did with this.
Thank you.
Thank you.
Thanks.